Dr. Parekh, the other thing that I wanted to talk about, and specifically for children, when is it that parents need to sort of ring the alarm bell and consult their doctor? Because what one is also seeing in many cases now, because of all these, home tests available, that people are just testing at home, just, calling their doctor over the phone, upping their vitamin and, mineral intake and curing themselves at home. But when is the time that you need to panic and you need to say that, what, I need to get my child admitted to the hospital perhaps?
I think it's a very good question, and people need to realize what are the red flags. So basically, when it comes to children, there is the mother's and the father's gut feel that there's something wrong with my child. That gut feel should never be ignored. Number two, from the day your child starts developing symptoms. Now, today and over the last 1 month, if your child suffers from cough, cold, fever, I'm going to stretch out on a limb and say that 90% of the chance your child has the virus. Don't panic. Talk to your pediatrician, talk to your doctor, have good lines of communication. He or she is going to get you through this. But as a constitutional approach, if the fever lasts for more than 48 hours, you need to see your pediatrician. If the symptoms of headache, body ache, sore throat, change of voice is there, you can do a rapid antigen test at home. If the rapid antigen test is positive, it is 100% the COVID virus. If negative, there is a 30% chance that it can still be positive. Aware and be very open towards your child's general condition. If your child's general condition is stable, you're okay. If not, in the form of excessive drowsiness, excessive vomiting, loose motions, and lethargy, please don't sit at home even in the first 2 days. Talk to your doctor, go see them, and take the right advice in the right time. If you do that, I guarantee you, hospital admissions will be most definitely avoided. I think we're already there. I think plenty of small children. I think the youngest we saw was 2 days ago was a 2-month-old child which tested positive. Just to keep you guys updated, the child is doing great. So, like I said, all the kids are recovering well. Now, whenever you have a child with symptoms or has tested positive, if the child is less than 2 years of age, you can't have that child wear a mask. So, the one of the parents has to step up with an N95 mask and keep the children or the child with them in one room. Now, let's take the bigger picture here. Our goal is to prevent and protect the elderly. So, whatever it takes to keep these children or ourselves who are infected away from the elderly people, we should do. We should protect them because these are the ones with comorbidities who tend to suffer or chance to suffer the maximum. Number two, if your child is between 2 and 8 years of age, the child can wear an N95 mask, and one of the parents can step up, the father as well, can step up and stay with the child. The latest recommendations are 7 days from the onset of the symptoms. If it's less than 2 years of age, nobody has the choice. A mother has to be with the child with an N95 mask at all times. If the child is above 8 years of age, 10 years of age, he's self-sustaining, she's self-sustaining. She can be trained to be in a room with the mask on for 7 to 8 days. But it is a difficult situation. So the dynamics of every house is very different. I think people are smart enough. It's been 24 months. We've been through the first, we've been through the worst. They're experts at isolation, they're experts at sanitation, they're experts at figuring out who stays whom and who to protect. So I think we'll need to trust the gut feeling of people by now. But most of the time, we still use N95 as our ace nuclear weapon against the virus till the vaccines reach all our children.